Hey guys, how's it going? Reed here. Today we're going to have a very interesting conversation on fictitious disorder. Um, Yesterday we went through somatoform disorder, right? And for the most part, a somatoform disorder is when you have real pain. Typically, you can identify an injury or a precipitating event, like a person had an injury, but the injury resolved or healed, but yet they're still feeling pain. And as somatoform disorder, is pain and discomfort in multiple parts of the body. And they actually changed the name to, I think it's somatization symptom disorder, right? One of those names. Um, but this is next one. We're talking about fictitious disorder. Fictitious disorder is slightly different than somatoform disorder, right? Think about the name fictitious. Fictitious. You know, I need to use that word fictitious more. Seems like it's a pretty good word to use. Let me see. Explain. Let me see. AI mode. Okay, explain fictitious disorder in a DSM-5. Oop, I said DSM-54. Yep, DSM-5. Okay. Okay. Factitious, not fictitious. Factitious. Um. Okay. Yeah. This is not my typo is not a clinical uh, disorder. Factitious disorder is a mental disorder where a person deliberately feigns or induces illness to take on the sick role. Right. That's it. That's all you need to know. Remember, with somatoform disorders, real pain with somatoform disorder in multiple locations. And sometimes the issue may resolve, but they'll still have the pain or discomfort, or the pain may cross anatomical boundaries or things like that may be very difficult to sort of discern. So in somatoform disorder, that pain is real, but in fictitious disorder is feigned, induced illness on the sick roll. A key distinction is that the deception happens without an obvious external reward, like financial gain, which would be considered malingering. You see, with that fictitious disorder, you don't know what the secondary gain is, right? But it's usually to play the sick role. It's usually for nurturing, right? These people present, and they present in more of a regressed manner, like they're children. And sometimes it seems they need someone to sit down with them and just empathize with them, just see things from their perspective and start understanding the world from their perspective. So patients with factitious disorder, they play the sick role by feigning illness because their sick role allows them to get into access with people with empathy who can sort of display empathy for them and towards them. So it's really interesting. Um, well, in malingering, well, they're they're lying. It's obvious what the game is. In malingering, typical situation, you see the patient comes into the emergency department with the cops in police custody, and all of a sudden they have a mental health condition, right? And so they emphasize the symptoms of their mental health condition as a way to try to get out of the legal issue. In that situation, the man tied to a gurney with the police there, and now he started to say, I'm not saying it's not, I'm sure you have to take the symptoms as true and everything, but in that situation, I see malingering often in that situations. The histories don't match up, right? Um, okay, the DSM-5 distinguishes between two types of factitious disorder. Factitious disorders imposed upon the self, right? Factitious disorders imposed on another, right? Um, On another, we see families imposing mental health conditions upon its members. The dysfunctional family units do that a lot. There's a lot of, they do that to the scapegoats within the family system, right? Usually, the healthiest person within the family system usually displays the symptoms, whereas the sickest members seem to be doing just fine. Everything's cool with them. They don't have any symptoms at all. It's you, yeah, because you're the symptom bearer for the entire dysfunctional family. And so, in this fictitious disorder, when they're surrounded by people who don't empathize with them, of course, they come into the healthcare system looking for individuals who can empathize them. So, factitious disorder imposed on the self, the targeting done by psychopathic families or psychopathic family members, they target through stalking, and covertness is the golden rule. They always stay, it seems all of them always stay covert. So when you're being attacked by, let's say, a group of sick narcissists, they all do it through third parties covertly because they never want to be exposed, right? So when they target you through third parties and individuals. And so it causes the person to have difficulties with the people in their environment, right? And that causes a lot of emotional, psychological distress. And it's hard to identify this because the psychopath or sociopaths are around you, right? And so that's when they come into the hospital. I'm looking for more support or for support for their self-esteem, their internal, their perspective, and things like that. Um, so this is factitious disorder imposed on the self. People who are psychologically abused come in, mistreated, or chronic PTSD. They come into the hospital and look for treatment. Right. Next is factitious disorder imposed on another. The person fakes or causes illness or injury in someone else, such as a child, to gain attention or sympathy for themselves. Right? The disorder applies to the perpetrator, while the victim is considered abused. Right? Um, we often see this when families trying to get disability checks or guardianships or things like that. Oh, they're imposed. They believe they're too sick than they really are, and basically they're trying to get gains. They're trying to get some gains or something like that for the patients. Um, Munchausen, remember Munchausen syndrome by proxy, make the kid sick and bring the kid in for treatment and things like that. And in these situations, you see the abuser already has a diagnosis, and the abuser always have the diagnosis validated, and the abuser always have a source that they can rely to, like, oh, his doctor did this, and don't have a relationship with the doctor. They set up these whole theatrical performances when they present their abuse to try to make you believe that there's a case management team, a treatment team, or someone else there who validated diagnosis, when it's just them abusing the person. Factitious disorder, these are really, really sick people. Um, this type of sickness is it presents itself in a way that no one can really do anything about. So, for example, when you have a person who's regressed down to, let's say, 5 or 6 years old, where they only have the defense mechanisms or the tools of a 5 or 6 years old, and they only have the cognitive powers or the capabilities of a 5 or 6 years old, when they get locked into that state and they need that constant reinforcement, the constant empathy, the constant support for their psychological functioning, they don't get that on the outside, and so they have to come into the healthcare settings in order to get these things. Okay. Both types. Identified deception. The person falsifies the physical, psychological signs or symptoms, or induces injury or disease. So they falsify it or induce it. We see falsifying, here's another, if you're watching this, here's another thing they do. If they're falsifying it, if you are being impacted by this, um, If you go to a doctor, they'll typically call your doctor on the phone, right? So when you're not there, they'll communicate you behind your back to either threaten your doctor or try to strongly persuade them that their diagnosis is correct. If the doctor doesn't agree with it, then there's a fight. I mean, they retaliate. The aggressors, the aggressors here, they retaliate against anyone who don't support their fictitious diagnosis or the meanings of the signs and symptoms. This means that, that means that. They go through a whole process of encoding to try to make sure that you agree with all the items in their world. And if you don't, then they attack you. Okay, next, presentation of illness. The person presents themselves or another as being ill or injured or impaired. Right. These people with fictitious disorders, if you're a victim of one of these, they'll go around and spread rumors about you that something's wrong with you or you're crazy. See, um, you see this in a fictitious disorder. The secondary game is hard to find. So it reminds me of narcissists, and how they always have to go around the people you work with and go around behind your back. They always have something to say about you, you know. And the narcs typically they make storylines about you to keep things going, and they keep revising the storylines. But these people are absolutely sick, right? Um, but what they do is this is weird. They cast the victim in a role, right? So that person's like this, that person like that, this person's like he's like that, she's like that. And they have to do it 101 because they're grooming the person. You have a sick narc grooming a person, wanting you to believe that someone's crazy. And what is crazy, particularly mental health, like bipolar, schizophrenia, it's like, but when they say this something's wrong with the person, they're trying to imply that there's something ethically and morally wrong with the person. The fictitious disorder present the person as if they were ill to people, right? So if you ever run around these people, or let's say a sick narc, if they're targeting you, they'll bring you around other people, right? They'll tell the other people, A, you're in reality A. We're gonna do this, that. And by the way, so and so's coming, and so, this is my best friend, and so's crazy, right? They groom them. Then when you come around thinking that these people haven't been groomed against you. And when the victim expresses themselves after that casting by the narcissist, when the victim expresses themselves, then there's more opportunities for people to find fault, to get upset, to not understand how they're responding to things. And all of this manipulative behavior is happening behind the scene with the sick narc. So if you work with a sick narc, oh my God, I mean, these sick people will force you to be on their side, or hold on, what's that? Presentation of illness. So that's what they do. They present you to people as if you were mentally ill, as if something was wrong with you. Now, as a victim, you think the interaction is just a little bit off. You can imagine that this person went through all that effort to go behind your back to everyone you work with and call you crazy. You wouldn't think that they would do that. But these sick people do. I mean, they do. Okay, let's see. Absence of external rewards. See, that's the thing about fictitious disorder, is The deceptive behavior is evident when there are no obvious, the deceptive behavior is evident even when there are no obvious outside incentive. The deceptive the deceptive behavior is evident. Okay, right. So you see what they're doing, but in the majority of cases you can't find the incentive, right? So I had a sick narc always talking about me. I mean, constantly behind my back at work. But when he talks to the people, they can't understand what his incentive is, right? Because he presents as if we're friends and things like that, if he really knows me and everything. But, pss, 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 right? This is the best example of that type of behavior that I can describe. Fictitious type. You have to be really sick in order. I see a combination. This person has a combination of narcissistic and fictitious, narcissistic with fictitious compliments. Sick person. Not explained by another disorder. Yeah. Okay, great. Not like if they were like psychosis or something like that, or bipolar thing, or if they were just messing up, if they were just having a bad day or week, then yeah. But yeah, so this is a fictitious disorder. Let me see. How. Okay, got me. I can't type and look at the same time. Again. How are fictitious disorders or the somatoform? So how are fictitious disorders, somatoform disorders similar and different? Okay, factitious disorders and somatoform symptoms and related disorders, the current term for what's previously known as somatoform disorder, both involve significant focus on physical symptoms that are not fully explained by a general medical condition, right? However, the crucial difference lies in the patient's conscious intent regarding their symptoms. That's it. It's the conscious intent. Similarities. Both involve presentation of physical symptoms that medical professionals may struggle to explain or attribute to a clear organic cause. Number two, both groups of patients may organize their lives around seeking medical attention and services, often presenting to healthcare settings repeatedly. Third, both factitious disorder and somatoform disorders are considered psychological conditions with significant emotional distress. So, motivation here, motivation for behavior, the motivation is internal, psychological, and assumes the sick role. The patient seeks attention, sympathy, and care. In somatoform, the motivation is unconscious and may not assume a sick role, right? Because remember, with a somatoform disorder, they can internalize the psychological pain and distress, and it appears as real pain and discomfort. So the somatic symptoms, this is unconscious, right? Um, yeah, I think that's the difference between the two. I think that's all I need to do for now. We're at the 18-minute mark. I'll end up for there. So this is my talk on factitious. I have to change. I can spell the word. I spelled factitious wrong on there. So if you have any other questions and everything, feel free to like, subscribe, and share. And otherwise, I'll talk to you guys later. Read out. Take care, guys.